All right, here we are, Chapter 4, Cardiovascular System. We are starting on slide 33. Here we're looking at congenital heart defects. So one of the defects that we have here first is the ventricular septal defect. This is what we saw a picture of in our last class. So this is where there is an abnormal opening between the ventricles. And if you remember from last class, this is going to cause the dilution of oxygen in the blood going out to our cells. We can also have a septal defect in the atrium. So we have the atrial septal defect, and this would be where there's an abnormal opening between the atria of the heart. So this one would be the same thing. We would have that diluted oxygenation of blood. Then we have patent ductus arteriosus. This is PDA. A patent ductus arteriosus is an abnormal opening between the pulmonary artery and the aorta. So an abnormal opening between the pulmonary artery and the aorta. Then we have coarctation of the aorta. This is where part of the aorta is narrowed. Okay, so if somebody has coarctation of the aorta, part of their aorta is narrowed, which would be restricting blood flow. And then the last term on this slide is tetralogy of Fallot. Okay, there are 4 congenital heart defects in tetralogy. So if you remember, tetra means 4. So there are 4 congenital heart defects, a part of this condition. You're not required to know the 4 congenital heart defects that make this up, but know that this is something where surgery may be needed to correct these 4 congenital heart defects that make up tetralogy of Fallot. Here we are looking at arrhythmias. Okay, if we look at that first term up there, dysrhythmia, broken down into word parts means difficult rhythm. Okay, so technically dysrhythmia is a more accurate term for an abnormal heart rhythm or a difficult rhythm. We typically use the term arrhythmia, like you see on the title of this slide, to mean a difficult or abnormal heart rhythm. So normally the intervals between pulses are of equal length. When they are not, that's when an arrhythmia is present. So an arrhythmia is when the intervals between pulses are not of equal length. Then we have heart flutters. Heart flutters are rapid contractions of either the atria or the ventricles. So these are rapid contractions of either the top half of the heart, the atria, or the bottom half of the heart, the ventricles. Then we have heart palpitations. Okay, this is a subjective sensation, meaning the doctor can't see this happening, okay, but the patient might tell them they feel this. And this is the feeling of a pounding or racing heart. Okay, so heart palpitations is when the patient is telling you that it feels like their heart is pounding or racing. Some people experience palpitations and have no evidence of heart disease, in which case the palpitations are believed to be normal emotional responses to stress. So you might feel this pounding heart or the heart racing due to stress. Then we have ventricular fibrillation. Ventricular fibrillation is a severe cardiac arrhythmia in which the ventricular contractions are too rapid and uncoordinated to be effective for blood circulation. So ventricular fibrillation is a severe cardiac arrhythmia in which the ventricular contractions, the bottom half of the heart contractions, are too rapid and uncoordinated to be effective for blood circulation. Atrial fibrillation then is a cardiac arrhythmia categorized by the disorganized atrial electrical activity. Okay, so again, the atria are contracting too rapidly or too uncoordinated, but atrial fibrillation is less severe than ventricular fibrillation. Last 2 terms on this slide are review. We had them a few classes ago. So bradycardia means slow heart, and it is a pulse less than 60 beats per minute. And tachycardia means fast heart, and it is a pulse rate of more than 100 beats per minute. Here we're looking at some more arrhythmias. The first one on the slide here is premature ventricular contraction, and that's PVC. PVC means that the ventricles are not contracting at the best time in the heart cycle to be effective. So when somebody has PVC, their ventricles are contracting, but not at the best time to be effective in our heart cycle. When somebody has PVC, we would diagnose this with an electrocardiogram or an EKG. Then we have PAT, proximal atrial tachycardia. This is where the heart races at 150 to 250 beats per minute and then returns to normal. So this term, we use that term proximal. This means occurring in sudden, repeated episodes. So when somebody has PAT, their heart's going to race at 150 to 250 beats per minute and then return to normal. Then we have atrioventricular block. Okay, an AV block, this is also sometimes called, is a disorder of impulse transmission between the atria and the ventricles. Okay, so there is that electrical impulse that's going from the top half of the heart to the bottom half of the heart as it contracts. There's some kind of transmission issue there. So impairment in the conduction of the impulse from the SA node to the other parts of the heart, okay, is what would be taking place. Okay, and this is also sometimes called a heart block. Last term on this slide is asystole, and asystole means the heart has stopped beating. Okay, so when the heart stops, the person is in asystole. All right, we're looking at more heart pathologies. The first term on this slide is myocardial infarction, or MI. Myocardial infarction is necrosis of a portion of the cardiac muscle. So necrosis means death, if you remember that. Okay, it's necrosis of a portion of the cardiac muscle caused by an obstruction or a blood clot in the coronary arteries. So something in the coronary arteries is causing a blockage. Okay, it could be a blood clot. When cells die, it's because they're deprived of oxygen. So that term, anoxia, means an abnormal condition categorized by absence of oxygen. Okay, so anoxia is what can cause cells to die or tissue to die because it's deprived of oxygen, and it means absence of oxygen. Then we have infarct, okay, a localized area of damaged tissue resulting from anoxia is what we call an infarct. Okay, so anytime that we have damaged tissue because of lack of oxygen, we call that an infarct. Then we have congestive heart failure, or CHF. This is impaired cardiac function such that fluid accumulates in the interstitial spaces. Okay, so when somebody has congestive heart failure, what's going to happen is there's going to be fluid that accumulates in the spaces around the heart. Then we have the term ischemia. Ischemia is insufficient blood flow to an area. So ischemia is when there is going to be not enough blood flow to an area. It's not stopped, but it's not enough. And ischemia may cause chest pain, and the medical term for chest pain is angina pectoris, or sometimes just angina. When somebody has prolonged myocardial ischemia, it can lead to a myocardial infarction or a heart attack. So if somebody has this ischemia in the heart lasting for a long period of time, it can lead to them having a heart attack. The heart damage may keep the heart from then functioning normally, and that leads to cardiac insufficiency. Cardiac insufficiency is when the heart is not functioning normally. Here we're looking at a picture of a heart attack. Okay, so myocardial infarction or a heart attack is necrosis of a portion of the heart muscle, and it's usually caused by an obstruction in the coronary artery. Okay, so here on this picture we can see the zone of necrosis. Here's where the tissue has died. Okay, here's where the tissue is just injured, and then here is where that insufficient blood flow is taking place. All right, some more heart pathologies. We have hemopericardium. Hemopericardium is an effusion of blood in the pericardial space. Okay, so let's talk about what an effusion is, and then we'll come back to that definition for hemopericardium. Okay, effusion means the escape of fluid into a part such as a cavity. So an effusion is where fluid escapes into an area it shouldn't be. So if we go back to that term hemopericardium, okay, hemopericardium is an effusion of blood into the pericardial space. So blood escapes from someplace it's supposed to be and builds up in the pericardial space. Cardiac tamponade, that's our next one. This is an accumulation of fluid in the pericardial space that can all lead to compression of the heart. The compression of the heart from that buildup of fluid in that pericardial space is what we call a cardiac tamponade. So the pressure, the compression that builds up on the heart from that accumulated fluid is cardiac tamponade. And then we have shock. Okay, shock is a life-threatening condition of inadequate blood flow to the body's tissues. So when somebody is in shock, okay, it's a life-threatening condition of inadequate blood flow to the body's tissues. So usually this is associated with inadequate cardiac output, hypotension, so low blood pressure, and tissue damage. Shock can be caused by hemorrhaging, so bleeding out. Shock can be caused by dehydration. And shock can then also result in hypovolemia. And that last term on this slide, hypovolemia, is the abnormally low circulating blood volume. So the volume of blood running through your veins is low.